Welcome to the Health Science Coach Podcast. My name is Drew Garner. I am a health science and physical education teacher here at Turner High School. My objective is to provide information to students about different healthcare careers and explain how these professionals got to where they are in their careers. Thanks for spending some time with us today. Now let's dig in. Today we get the pleasure of meeting with Christian Lozano. He is a clinical laboratory science resident at the Kansas City VA Hospital. Welcome, Christian. How are you?
I'm doing well. How are you doing?
Doing great. It's a beautiful day out today here in Kansas City, and we're just talking a little bit about it and, wanting to get out and enjoy this nice fall weather that we're having. So what is, in your words, what is a clinical laboratory scientist?
So clinical laboratory scientist or medical laboratory scientist, the two are used interchangeably, basically is a specialized healthcare professional that tests patient specimens to help detect, diagnose, and then treat illness and maybe even monitor health. So from wellness checks to something that's pretty relevant now, to the COVID-19 pandemic, medical laboratory scientists use sophisticated instruments to analyze blood and other body tissues and fluids to investigate events that, in a sense, make headlines all over the world.
Yeah, that's pretty interesting. So, going into your undergraduate, how did you choose to become a lab scientist?
Oh, that's a long one. Let's shorten it down a little bit. So originally going into college, I had the ambition to go to med school, as a lot of people do. And I still did for a long time, even as a junior when I was already in the program, that was still something I really wanted to do. But going back a little bit, my sophomore year, my first degree that I was aiming for was, what was it? Bachelor of Science in, I believe, one of the biologies, can't remember what it was now. And I just told myself, you know what, if I have a break in between, if I can't get into the medical school that I want to, what am I going to do? How am I going to make an income? I want something that is still healthcare related, something that that I only need a bachelor's, and something that pays well, of course. And I was walking down the hall one day, and actually it was a poster that caught my eye, and it had looked like a scientist. It was a scientist, and they were doing some stuff in the lab. It kind of just said what the program was, and I was interested, sent them an email, and they told me to enroll in their CLS 200 class, I believe it is. They have an intro class, I think it's 201 maybe, that students can take at KU, and they kind of give them just a brief overview of all the things that a CLS will be able to do. And that really caught my attention. And then I decided to apply, and I got accepted my end of sophomore year, and started my junior year.
Cool. So like you said, you went to undergraduate at the University of Kansas. You graduated in 2016 with your Bachelor of Science in Clinical Laboratory Science. What does, you said you took a class your sophomore year, kind of that introductory level class. What does the rest of that program kind of look like to get that bachelor's degree?
Okay, so looking at the whole 4 years, so if you go to KU, it is a 4-year program. So it's the first 2 years are what you call the 2 years of prerequisite coursework. And then it's followed by 2 years of clinical laboratory science courses. So your prerequisites are basically like your basic bio and chem classes, followed with like any of those core classes that you have to take: English, social,
College
science.
Yeah.
And after you do that, you have to at least have believe it's still 3.0 GPA. They require shadowing experience, and you're able to apply. Once accepted, you kind of start, and it's more advanced science classes. So you look at classes such as hematology, chemistry, microbiology, immunology, blood bank, or the actual term is immunohematology. Those are the 5 core classes, or 5 core clinical medical sciences that you are heavily involved in when you're in this CLS program.
Right. So while you're doing that, I believe you had a job as a lab assistant. Is that correct?
That's correct. Yeah. So so 2014, when I got accepted to the program, I was like, I'm gonna need a job. Um, I always had to. I mean, I got scholarships and stuff. It was always nice to have a little bit of extra cash in the background. So I decided they had, I think it was 2 weeks into the program, they had promoted, or I think Children's Mercy had promoted a assistant position in microbiology. And I always enjoyed microbiology. So I was like, why not apply? And this was actually geared towards students in the CLS program because they kind of want to um, groom you to be one of their clinical laboratory scientists. So
Right.
I got a job there in chemistry, and right 2 years later, I got a job there. That was my first job as a CLS, was in microbiology. So it's kind of like a uh, I wouldn't say a promotion, but kind of was.
Right. Kind of like a pre-internship to what you were actually getting to
Yeah,
become
that's a
once
good
you
way.
got
Yeah, that's a good
right.
way to put it.
Good. So then you worked there for a couple years and you decided to go back and get your doctorate, also at the University of Kansas, and that is at the University of Kansas Medical Center in Kansas City. What kind of wanted you to continue your education path?
So stepping back, as I mentioned before, I did want to go to medical school. So just from that standpoint, I had always wanted to continue progressing to become a clinician. I've always liked that patient interaction. When you're in the lab, you don't necessarily get the patient interaction that you want. There are opportunities to get that just because the lab world is so vast and there's so many different routes to take within the lab world. Even with your bachelor's, the doctorate was aiming at creating more of a direct interaction with clinicians and making those patient connections and having those important conversations with core members of the clinical team and being able to provide critical interface between practice, research, and even healthcare policy. If I can, let me explain what the role of the DCLS
Yeah.
practitioner is looking like. It kind of assures the effective and appropriate use of lab tests and information that comes from these lab tests, which could result in decreased costs, earlier diagnosis, and improved patient outcomes as well. Um, they'll end up working alongside, as I mentioned, healthcare providers, external and internal to the clinical laboratory, and they'll even integrate information from laboratory professionals as well. So it's going to be a really good profession. A little more about the DCLS. Currently, there's only three schools in the U.S.
Okay.
One being KUMC, the others are Rutgers and UTMB in Texas. So
Uh-huh.
they are the first three schools, the first three programs, and it's a lot of pioneering currently. It's very new. Currently, the job market for DCLS is not big, but it is increasing very quickly. So it's a very exciting time.
Yeah, absolutely. I can see that being a high need, especially with COVID coming out and the need for all the different types of testing available with that and providing, so many potential future opportunities for testing for what we don't know that's out there. That's pretty interesting. Um, so you chose University of Kansas, obviously, one of the three programs, and it kind of worked out to your advantage because you had your undergraduate from there as well. Um, Kind of walk us through what the years and the classes kind of look like, as well as what types of rotations or anything you need to get for your doctorate there.
Okay, so I'll even talk about undergrad a little bit because, yeah, I think undergrad was just as exciting as my doctorate. So for the undergrad portion, you get to do a rotation as well. It's a 6-month rotation. That's basically your last semester where you get to go to a hospital and basically do on-the-job training and learning to kind of fortify the information that you learned in school. Um, of course, mine was at Children's Mercy. It kind of just stayed where I was. Um, but instead of just doing micro, I got to see all the other areas of the lab, kind of fortify all the information that I had learned, and it was a good experience. Really humbling as well. and it goes by fast. So moving on to the DCLS, so I'm currently in my third year. This is my resident year. So the first 2 years are very much didactic work or book work, which is pretty heavy because basically what the DCLS is it's about 60% to 70% clinical work and then 30% research. So you're kind of combining a PhD with I won't say MD, but with a clinical doctorate, putting them together, and then that's the DCLS. So you kind of get the best and worst of both the worlds. So it's a really it's a really hard degree, but the first 2 years are done and over with. It was a fun time, very stressful, but it was well worth the time and effort. Now that I'm in my residency, it's fun to see how far I've come and to see where I'm able to step in to the interprofessional collaboration between physicians and nurses and all the other professionals within the healthcare world and see where I fit. It's been really fun.
Yeah, absolutely. I can see how that would be a really cool collaborative piece that was missing. Being able to have that testing available and being able to diagnose through that kind of information. So you're in your third year. You said you're working at Research Medical Center. What are some of the daily tasks that you do while you're there?
So I plan for that question. So I currently am a microbiologist. I kind of specialize right off the bat as a CLS, and that's something that isn't necessarily common. A lot of CLS, once they graduate, will become generalists. That's the term we use, and that's where they kind of work in hematology, chemistry, and blood bank. That's kind of like the trio. It's called the general lab. I specialize in micro, and what medical microbiologists do is we support and oversee the prevention, diagnosis, and treatment of illness caused by microorganisms, so viruses, fungus, parasites, all the fun stuff. They identify the best treatment for particular infections and disease, and then monitor patients following treatment. That's not something that all medical microbiologists do. It's more something that once you get your doctorate, they get to do that. But CLS or MLS, what they get to do is they get to give advice on the best samples to collect to diagnose an infection, such as what swab to use, what blood test to collect, and what urine to test. Then they work with scientists in the laboratory to discover what causes that infection as well. So this may be a bacteria such as MRSA, which is pretty common. Most people have heard of MRSA. It's a skin infection. Usually it can be other places on the body. A fungus such as thrush, also a common fungus that most people know what it is, and then the virus, which influenza or COVID, which is very common now. So we get to identify those, and it's really fun, especially the bacterial side, because we get to grow it, we identify it, we get to see it, we get to see all the pretty colors and stuff. So I think if anybody's really into science, they like organization, they like the color behind it, then I think micro is the best way to go. I'm a very organized person. I'd even say I'm a little OCD, and micro is definitely the area for me because I get to control things, get to organize it the way I want. So, and then another thing that medical microbiologists do is they play a key role in antibiotics. So on top of identifying these bacteria, we have to perform antimicrobial sensitivities, which we give these to the clinicians, and they get to determine what antibiotics they're going to give the patients. So we provide key information for physicians and clinicians.
Yeah. So are you able to test the different antibiotics on the different types of test subjects that you have in your lab?
Yeah. So on a patient, let's just say they have a skin sample and it's growing a Staph aureus, which is pretty common. That's where MRSA comes from. MRSA stands for methicillin resistance. So we do a sensitivity panel, and it gives you, let's just say, 10 drugs. Methicillin or oxacillin, which is a derivative, will tell you if it's MRSA, and we'll report that out to the physician. They'll decide what antibiotic they're going to use from that information, because it'll tell them if it's sensitive or resistant, and then that's basically how a physician will just prescribe antibiotics to you.
Okay, that's pretty cool.
Yeah,
that's interesting. So in your previous jobs, we have a earlier job as a protein purification at Core Lab. It says you performed PCR and DNA transformations, protein purifications, and gel. Is this like uh, a job that a early college person or high school person could look at for if they're interested in that kind of field?
Yeah. So this is something I did by chance, actually. So one of the jobs I had in college, my freshman and sophomore year, I was a desk assistant at West Campus, which, if you know, at West Campus it's a science campus, west side of KU, and they do a lot of advanced laboratory work. So I was just a desk assistant, and one day I had become friends with a couple of the scientists there, and one of the PIs kind of asked me if I wanted to help him in his lab. And I was like, sure, I think that'd be fun. I think it'd help me out in my future career. It was Dr. Gao. I believe he's still there. And this was his lab, and he asked me to help him out. And yeah, I was able to perform PCR testing, which definitely helped me out in my future career because molecular diagnostics, which is heavily PCR based, is a big component to a CLS degree. And so on top of that, DNA transformations, protein purification, all these other things, they were all the basic building blocks to a more advanced degree. So these are all opportunities, and that's actually something I wanted to talk. And I think we'll probably get into this in a second, so I'll leave it for a little later. But uh, but any opportunity that comes your way, take it. I feel like that's something I didn't learn early on in my career until probably my junior or senior year of college. And I wish I had learned it earlier because I missed some opportunities that I didn't take. This was one of them that I did take, and I was very appreciative that I did take it. I'm very proud that I took it, but yeah.
So talking about advancing career and looking at opportunities, your next role was a admissions representative at Lawrence Memorial Hospital there. So basically just admitting patients, getting them into the hospital, asking them questions. What kind of led you to that position in college?
So as I've discussed, I wanted to go to med school, and I wanted to step into the healthcare world early on. Of course, there's shadowing experiences, which I did, and I do advise students, if you want to go into healthcare, please shadow. It's don't be afraid to ask. Email somebody at your hospital, and they'll be more than happy to facilitate you if they can. But I did it for that reason, that I had already shadowed, but I still wanted to be in the hospital setting more often than just a week of shadowing. So I found this position, which this was based in the ER, or emergency department, and it was really cool. I got to see some very amazing things. Of course, I wasn't clinically working. I was more of a admission representative, as you stated, and all I was doing was taking insurance information from patients, getting their demographics, and making sure that was corrected in the system. That way, providers could do their work. And I mean, that's just as important as a job as everything else in a hospital setting. And it also, ironically, every clinician should know insurance. So it really helped me early on to learn that earlier than later. So I had a step up in front of some of my colleagues. So that was good.
The hands-on experience of being able to deal with the insurance as being the front desk representative and admissions rep. I could see how that would be important later on now in your career, looking at the testing and what to look for different when you're diagnosing stuff and being able to tell them what to use or what not to use. That's pretty interesting. So then you did, after you got your degree, you went on and worked at Children's Mercy as the clinical rep or clinical laboratory scientist. What is the kind of the difference between working at Children's Mercy or Research Medical Center, other than Children's and VA?
Okay. That's a big question. I don't know if we have enough for that. So Children's Mercy, as you stated, yeah, that's the big difference with Children's Mercy. It's a children's hospital. When you look at clinical laboratory data, uh, you have children and you have adults. So children, their laboratory data, some tests will have different reference ranges, reference range being the normal for a patient. So the
Right.
normal for a child will be different than the normal for an adult for many of the tests that we perform. So that's a big
So
difference between the two hospitals. Now, when you look at hospital settings, so the three hospital settings I've worked at are Children's Hospital, which was a private non-for-profit hospital. Then you have research, which is a private for-profit hospital. And then you have the VA, which is a government hospital, which is totally different than the rest. That is also a big difference. When I first started at the VA, I'll just tell you that it was a whole different ball game for me. I had to learn so much different lingo compared to what I had learned in the private sector. So it was a whole different world. But that in itself is the biggest difference I think. Patients, you'll have different patients. So there's not really a big difference there because they're all there for the same reason. They're there for you to care for them. So they're vulnerable. So they want you to care for them, and you just need to show them that you care, and
right.
and that you care, and that you're there to work for them. Um, so there's not a big difference there. But everything else, so looking at laboratory data, looking at the setting of the hospital, and also kind of looking at what areas you're working for. So like Research Medical Center is in more of a low income area of the city as opposed to Children's Mercy, which is they work with low income, but they also have a different population, which is high income. So it's just a lot to take in. It's very demographic based. There's probably a ton more differences that I can probably describe. I think those are the biggest ones.
Yeah, that definitely makes a lot of sense based off the demographics, and the patients are the patients and they're the ones that are there to be cared for. Um, so kind of looking at your career so far, you're in your third year of residency for your doctoral program. Looking back, what is something that you're most proud of so far?
Ooh, something. So the biggest thing would probably be getting into the doctorate program. As I said, um, if an opportunity comes your way, always take it. And I was very hesitant at first to apply for the DCLS. I excelled in school, but I wasn't like a 4.0 student. I'll say that. I'm proud of it. I'm proud of what I accomplished, but I was very afraid that I wasn't the best candidate. Um, and I applied and I was admitted first round.
Yeah, that's awesome.
And it was decently competitive. So I was very proud of that. Other things I'm recently proud of is I'm becoming very involved within professional societies, which I think that's another question that we're going to come on. So do you want me to
Yeah,
touch
you
on
can go
that?
for it.
So yeah, so looking at professional development, I've kind of come along in personal development. I've come a long way. Um, with any professional degree that you get, there's going to be professional societies, and I highly recommend that you join your professional societies. So for me, um, there is AACP, which is the American Society of Clinical Pathologists, and then there's AACLS, which is the American Society for Clinical Laboratory Scientists. Those are the two big ones that we're involved in. And recently, I've become very involved with the AACP to the point where I've been accepted into two really high profile committees with AACP. So I'm really proud of that achievement. Other achievements I've done, like I recently got approved to join the Choosing Wisely committee, which Choosing Wisely is something that's pretty recent, pretty new. It's a group of individuals that come together to look at different guidelines that can be implemented in the hospital setting and can recommend those to clinicians to improve patient care. So I was also very excited about that.
Yeah, absolutely. That's pretty exciting to be, involved in, especially with as up and coming as the career path is what you're in right now. Do you have anything you regret not doing in, maybe in high school and college, in the doctoral program?
There's a lot. There's a quite a few missed opportunities that I never took and I probably should have taken. So one missed opportunity that I probably should have taken is well, not so much in high school. I think I enjoyed high school pretty well. I was um and then college, if there was anything that I didn't take, it was probably not enjoying college more. So I kind of took it very seriously, and I think college you should take very seriously. But for example, I was in marching band and in college, and I only did it for 2 years, and I only did it for 2 years because I wasn't able to do the last two because of the program. I just
Right.
couldn't fit it in, and of course, you have your priorities. So that's something I wish I would have had time to do. And something else I wish I would have done is during my early career as a clinical laboratory scientist. I wish I would have kind of pushed a little bit more. Although yes, I've pushed now, and I'm going to be a DCLS by next year, hopefully. I will be, but um, I wish I would have looked at management positions. I probably would have qualified, and I thought to myself I didn't have the experience yet. But now that I'm further into the clinical laboratory world, I see that even young managers are accepted, especially if they have that skill, which I believe I do. Well, I know I do, but um, but yeah, that's a missed opportunity. I wish I would have done.
So you touched on for a second early on. We talked. You said you had got some scholarships. In high school, what were some of the things that you uh, were involved in or worked at to make those scholarships available to you?
All right, so since uh, I'm pretty good with applications for college and stuff now, I think at this point, and I think one thing that all high school kids should know is that you need to be well-rounded. There's no ands, ifs, or buts there. So you may have a 4.0 in high school, and you may be applying to an Ivy League school or to just I mean, KU is a wonderful school. Um, they look at that 4.0, they like it, but they're also going to make sure that you're well rounded. So they want to make sure you're doing extracurricular activities. They want to make sure that you're doing stuff that you enjoy. So for example, I was heavily involved in music. I made sure I competed in music. And I did marching band as well. But then I also did extracurriculars. So I did a lot of volunteer work in high school. Mostly, I did a lot with my hospital. I also did a lot of volunteer work with some of the societies that I was involved in, or the clubs I was involved in. So, for example, like National Honor Society, if you have that, which I think most schools do.
Yep.
And then what else was I in? There was some healthcare clubs that I was in, stuff like that. Those are all, although you think they're taking time, or some kids may even think they're a waste of time, they're not. If you're planning to apply to school, the admission advisors actually look at this stuff. I think there's a bad trend that going about that kids are learning that it's really easy to get into college. You don't really need to do much. That may be the case, but is it really preparing you for college though? Because once you get into college, it's a whole different ball game. And I think having all these extracurricular activities in high school prepares you for the worst to come in college, actually, because it gets kind of stressful, especially if you're really involved with the extracurriculars in college, which I also recommend because looking at more advanced degrees, it's the same case. You're looking at the same exact scenario where you need to keep doing extracurriculars. You need to keep volunteering because let's just say if you want to apply to med school, or if you want to apply to the CLS program, they look at all these extracurricular activities because they want to make sure you're well-rounded.
Yeah,
That's the
absolutely.
key
And
word.
it also kind of helps show that you're able to have time management as
Mhm.
well as have communication with different people. all that different well-roundedness that you're talking about, and not just being too specialized in one thing or not being involved in anything.
Yeah.
Exactly. So you kind of touched on your professional development. What do you personally like to do on your time that, maybe it's something about books or, being out in nature or seeing stuff? What is it that you like to do personally to kind of develop yourself?
Yeah. So yep, you mentioned books. I'm as it may seem, I am very much a nerd, but that's okay. I like to read. But not only that, I do like to get out and about. I do like to ride my bike. We do that. We have two dogs, so I like to walk my dogs when I can. I think it's very relaxing, especially on days like this, which I'm planning on doing later on. Um, on top of that, since I wasn't banned for so long, I don't want to lose that skill. So I tend to I played clarinet for a long time, both in marching band and competition. So I do that to relax from time to time. What else? There's quite a few. Um, because this gets a bad stigma, I don't usually like to mention it, but I think it's important because I kind of want to get rid of that stigma. I'm also I like to video game. So it's a relaxer. Just don't sit there for 8 hours. If you want to like play a video game while like in between studying for like an hour, that's good. Just do it. If it's going to help you relax, do it.
Yeah, that's kind of funny that you look at it as a kind of a bad stigma. I mean, people that do it for professions, and yet other people that just do it, like you said, at time suck. 8 hours at a time and just not getting any benefit out of it. But like you said, being able to take that 1 hour break is kind of the mental mind dump, and not have to think about anything and just kind of sit and relax and enjoy what you're doing for a while. I think that's something that's really important, like you said, to not only high schoolers but professionals as well.
Yeah.
What do you think is something that you wish you would have really, really known in high school or college or early on in college that would help you with your career right now?
I'm going to have to reiterate the fact that if an opportunity comes your way, take it. Don't miss out on an opportunity, even if you have some self-doubt, because I think that's still one of my flaws. And it's very important. If you haven't sat down to look at your what you have as a flaw, I would do that because it's very important. Because that's a tip now, and um, it's always an interview question. So I would learn those now. But I tend to I'm my worst enemy. My worst enemy is myself because I'm probably my worst critic. Um, so I tend to not take opportunities all the time. Now I do because I've learned my flaw and I know how to work around it. But um, definitely take any opportunity that comes your way. Don't be afraid to jump at these chances.
So looking at specifically taking opportunities, that could be someone saying to you, hey, you should apply for this, or hey, look at this opening. What do you think about opportunities that people don't necessarily have right in front of them? So say a kid wants to get into volunteering, but they have no idea of what to do to take advantage of getting into volunteering.
Yeah, so there's always resources available to anybody. So let's just say it's a high school student and they want to get into volunteering. There's always going to be that adult or somebody at your school that will be able to provide you with the information that you need. All that it takes is for you to ask somebody for help. I think that's the key here. Just ask for help. And there's all if so that's for a high school student. If you're in college, that's the same case. There's always going to be somebody that you can go to ask for help, ask for the information that's needed. Of course, now we have internet, so a lot of times I think kids nowadays are probably a lot more internet savvy than even me, which I'm very techie, but sometimes I've learned stuff from my little sister and I'm like, holy moly.
Yeah.
But so there's internet as well. You can always Google something, and if that doesn't answer your question, just ask somebody.
Yeah, I like that a lot. There's tons of people around. The college advisors, the
Mhm.
career advisors, all these different people to help you. You just got to be able to reach out and find that person and let them know you do need help. Like you said, you like to read a lot. What is a book that you would recommend to a high schooler or a college student that thinks that they might be interested in being a laboratory scientist?
I love this question because I love this book. I actually read it in my undergrad for CLS. That was, we were asked to read it by my microbiology teacher, and it is The Hot Zone by Richard Preston. And some of you may like hear this title and it may sound familiar. It's because they actually made a series out of it. I think it was a 3-episode series on Amazon, I believe. Can't recall. It's been a couple years since that came out, but it's an amazing book. And what it does is it traces the true events surrounding an outbreak of Ebola. So the Ebola virus, and it's at a monkey facility in Reston, Virginia, in the late 1980s. So it's a very important event. So it kind of talks about the danger that that this outbreak posed. And then the author provides background about several other viral outbreaks as well, particularly in Africa, which is where a lot of these big outbreaks kind of take place. And these were like in 1970s and 80s as well. So it's a very fast-paced scientific thriller. It has a fictional work to it, but it's all based on factual events. So like the lady that's in this book actually lives in Manhattan, Kansas, if I'm not mistaken.
That's pretty funny. That's cool. I'm gonna have to look into that because I believe I've seen the series, but I can't remember if I've seen it or not. But it sounds very familiar. What's a product that you use on your daily basis to help you with your job duties?
My phone. uh, Sorry, I had to put that in there. I don't. A product that I use on a daily basis. Coffee. No, it's not a product. I don't necessarily have a product that I use on a daily basis.
Something in the lab that you guys use a lot that is something that kids would be interested in playing around, like Petri dish or something like that.
Okay, a microscope. So something that most clinical laboratory scientists use in any area of the lab is a microscope. That's always fun to use. If you get the chance to use one, I would definitely do it. I think most of the time, any degree I believe requires a basic biology. So I think within that biology class, if you take the lab, you get the opportunity to play with the microscope. So I say play because at that point it was playing for me, but you'll get to work with the microscope.
Right, absolutely. So this next one, I have three left, and this next one is kind of a two-part question. It's if you like blank, and if you dislike blank. So our athletic trainer stated that if you dislike feet, then being an athletic trainer is not for you. So if you dislike, because they're wrapping feet all the time,
I see that, yeah.
Yeah. So if you dislike blank, then being a laboratory scientist is not the right career path for you.
I think this can go a lot of ways. If you dislike bodily fluids, then being a laboratory scientist is not for you.
Yeah, absolutely. I could definitely see that. And then if you do like blank, then being a laboratory scientist is the right career path.
If you like being a detective and solving puzzles, then being a laboratory scientist is the right career path for you.
Yeah, I like that a lot. That's a true statement right there for you.
Mm-hmm.
And then the last one is if you have a mantra or quote that you like to live your life by.
There's many. So one that comes to mind is, above all, don't fear difficult moments. The best comes from these moments. So this was by Rita Levi Montalcini. She was a Nobel Prize winner in physiology or medicine. I think it was jointly. But yeah, I think that's a very good statement.
Absolutely. It's pretty powerful too. Well, thank you so much for spending 40 minutes with us talking about being a laboratory scientist. If there's anything that anybody wants to get in contact with you or talk more about, I will put them in touch with you about opportunities and stuff like that. So thank you again so much. I really appreciate it.
Yeah, thank you.